Good day to every listeners and doctors. We are from Group 2 and now I'm going to present Assignment 1 for SCBB 3023 Biomedical Imaging. In this assignment, we are requested to identify problems in biomedical field from various aspects and also propose an innovative solution to solve it.
First and foremost, let me introduce you our group members. First is me, Chan Si-yuan. Secondly is Emily So Jingyuan. Thirdly is Muhammad Aizat. Fourthly is Dania Nordini. And lastly is Musab.
Hello, I'm Emily. Due to this assignment, I had the opportunity to chat with Eva. She is a recent graduate in medical imaging from UITM, recently working as a radiographer in a clinic. She has 1 year working experience. Her primary responsibilities involve conducting x-rays and managing pneumoma cases. In this survey, Eva said that she frequently encounters challenges with grainy images. She said that this is due to insufficient exposure factors for patients with larger and thicker bodies. This made doctors face difficulties in diagnosing the images due to the low contrast in the radiographs. Eva has shared one of the cases related to this problem during the pneumoma case. She encountered a situation where a worker had a larger body size. Even though she has adjusted the exposure factor, however, the image quality is still low. Therefore, she had to retake the radiographs multiple times to achieve a higher quality result. The main reason for her facing this problem is because of the lack of equipment in the clinic. She mentioned that they don't have a stationary grid to make the scattered photons absorb, so the image quality is lower. When asked about the integration of AI in imaging processes, Eva felt excited. She said that she is excited and looks forward to it. She believes that AI will conquer the imaging field, especially in image recognition. Eva always refers to KKM guidelines and MSR to ensure that work aligns with relevant standards and guidelines, especially in addressing radiological image artifacts.
Next is the proof of our interviewing process. For information, our interview is done by using WhatsApp.
Based on the interview results and also the research that we have done, we identified a problem in biomedical imaging, which is radiological image artifact. Radiological image artifact refers to any irregularities, distortions, or unintended features present in radiological images that do not accurately represent the anatomical and pathological structures being imaged. Radiological image artifacts have a significant impact on the accuracy and reliability of medical diagnosis, leading to misinterpretation by healthcare professionals, potentially result in incorrect diagnosis and treatment decisions. The image following is the results of the radiological image artifacts produced. Firstly is the grid artifacts, which is produced by X-ray. Secondly is the static electric artifacts, which produced by X-ray too. While thirdly is the magnetic susceptibility artifacts, which produced by MRI. While lastly is the motion artifacts, which produced by CT scan.
Hi, in this part I'm going to represent to you the challenges in radiological image artifacts. So, the first artifacts we can say it's the motion artifacts. It causes when patients' movement during the image acquisition, often due to the breathing or involuntary muscle twitches or restlessness. The impact of this challenge is results in blurred or destroyed image, making it challenging to distinguish fine anatomical details. And for the next challenge, we have the metallic artifacts. It calls when presence of metal objects within the image field, such as orthostatic implants, dental phalanx, or prosthetics. This will impact as a streaks or shading in the image. Quantitative measurements may be affected, leading to challenges in accurate diagnosis.
Radiological image artifact can arise from various sources, and addressing these limitations is crucial for accurate diagnosis and interpretation of medical images. Here are some common limitations associated with radiological image artifact. The first one is incomplete or incorrect collimation. The incomplete or incorrect collimation often results from human error, inadequate training, or equipment malfunctions. Imaging technologies may neglect to adjust the collimator to the appropriate size, leading to unintentional exposure of neighboring tissues outside the target area. The consequences of improper collimations are twofold. First, there is an increased risk of radiation exposure to non-targeted tissue, posing potential harm to the patient. Second, the compromised collimation negatively affects image quality, resulting in reduced clarity and precision. This, in turn, can lead to challenges in accurately diagnosing and interpreting medical conditions, diminishing overall effectiveness of the imaging process. Next is the slice thickness artifact or partial volume effect. The partial volume effect occurs when the structure smaller than the slice thickness are inadequately represented in the imaging process. This phenomenon is often a result of insufficient optimization of slice thickness based on the specific clinical task at hand. The impact of slice thickness artifact is significant. Loss of spatial resolution occurs, making it challenging to distinguish between adjacent structures with precision. This compromises the ability to capture fine anatomical details accurately, potentially leading to misinterpretation of clinical findings and reducing the diagnostic reliability of the image. This is the aliasing artifacts. Aliasing artifacts results from undersampling or inadequate pixel resolution during image acquisition. These occur when the imaging system fails to capture high-frequency details adequately. The consequences of aliasing artifacts are notable. They introduce distortions in the image, providing a misleading representation of high-frequency structures. This distortion compromises the overall quality of the image and may lead to a misinterpretation of anatomical features, impacting the accuracy of the diagnostic process. And lastly, the post-processing artifacts. Post-processing artifacts arise from the improper application of image processing techniques, including filtering, enhancement, and reconstruction algorithm. If not carefully validated and optimized, these techniques can introduce unintended distortions in the final images. The impact of post-processing artifacts is multifaceted. Unwanted distortion compromises the diagnostic quality of the image, potentially leading to misinterpretation of pathological findings. The reliability of diagnostic conclusion is jeopardized when the post-processing is not meticulously executed, undermining the overall effectiveness of the imaging workflow.
In order to address the radiological image artifacts, we have proposed two innovative solutions to address these problems. Firstly is medical image fusion techniques, an efficient deep learning method for combining three medical images using convolutional neural networks. This method fuses multiple images from different exposure levels, creating a high-resolution composite image. This method focusing on quality assessment based on gradient change between exposure. Following is the scientific evidence for the biomedical image fusion techniques. On the left-hand side is the convolution image of MRI and CT scan, while on the right-hand side is a convolution image of MRI and PET scan. As a result of these techniques, the image that produced have become more detailed and clearer. While the second innovative solution is quantum optimization algorithms for image reconstruction. The algorithm using qubits, combining experimental imaging diagrams with optimized qubits to reconstruct the image. It deploys global energy optimization, executable on gate model quantum computers or quantum annealers to determine qubits values. This new approach utilizes an iterative optimization algorithm that operates on the entire medical image, reducing errors caused by artifacts. The following is the engineering principle for the quantum techniques of the image reconstruction. The raw data of a projection image set is sent into a system for artifact corrections to produce optimal synograms. After optimization, the qubit or the Ising models with hybrid solver will determine the logical qubits from the lowest energy to reconstruct and produce optimized CT image. The right-hand side is the formula for this technique, while the below one is all the image technique for the image reconstruction.
So now I'm going to explain to you about the benefits of the medical image fusion techniques. So firstly, it will improve diagnostic accuracy by combining information from multiple modalities. Thus, it provides us a more comprehensive view of the anatomical and functional aspects of the image region. And next, it will also enhance the visualization, as the fusion techniques can improve the overall quality and clarity of the medical image, making it easier for healthcare professionals to visualize and interpret complex anatomical structures or pathological conditions. And then it will also give us a comprehensive information, as the fusion allows the integration of complementary information from different modalities. It will also provide us a more complete understanding of the underlying physiological or pathological process. Besides that, it will also give the professional healthcare a better treatment planning, as the fused image can aid them in treatment by providing a more detailed and accurate representation of the targeted area. Next, it will also reduce the ambiguity through fusion of the image, as the information from modality can help clarify or corroborate findings in one another. Last but not least, it will also improve the localization of abnormalities, as the fusion techniques can help localize abnormalities more precisely by combining structural and functional information, leading to a better targeted interventions. So now we are going through the drawbacks of this solution, which is the image registration. Aligning image from different modalities or time points accurately can be difficult, as the image registration errors may introduce artifacts or inaccuracies in the fused image. Then we will also face the data quality variations. The difference in resolution, contrast, and quality between images from different modalities can affect the reliability of fusion. Low quality input data may lead to suboptimal results. And then we will also have a computational complexity. Some fusion techniques, especially those involving complex algorithms or large datasets, may be computationally intensive and time-consuming. Then we will also face, obviously, the cost considerations, where implementing advanced imaging modalities and fusion techniques may involve higher costs in terms of equipment, software, and training. And lastly, the radiation exposure. In cases where fusion involves modalities with ionizing radiation, for example CT scans, there may be concerns about increased cumulative radiation exposure to the patients.
Thanks for watching and have a nice day.